Colorado Medevac is a CAMTS accredited program that strives to optimize patient outcomes through cohesive scene and interfacility collaborative management of the critically injured or ill patient. Medevac uses state-of-the-art, industry-leading patient protocols. A dedicated flight crew consisting of a pilot, nurse, and paramedic bring their special training and advanced life support, trauma intervention, high-risk OB transports, and critical care to patients in a 300-mile radius from either the Erie or Greeley base. With cruising speeds of 140 miles per hour, Medevac's Bell 407 aircraft has a surface ceiling of 20,000 feet. Safety is our #1 priority. The Bell 407s are both equipped with ground proximity warning systems and satellite-based weather. Crew members also utilize night vision goggles to enhance the safety of night operations. Medevac places safety as our #1 priority. Before any flight can occur, local weather must be checked. Medevac has a minimum requirement of a ceiling of 800 feet during the day and 1,000 feet at night. We must have at least 3 miles visibility day and night and at least 5 miles visibility in mountainous terrain. Conditions that Medevac will not fly in are high winds with severe turbulence or icy and foggy conditions. If there is any question, Medevac must be consulted to check the conditions and determine whether they can accept the mission. FAA regulations are followed, and safety is a primary consideration in every Medevac flight. This is especially true in regard to landing zone safety and safety around the aircraft. Let's take a closer look at these issues by examining some general aircraft safety guidelines. Let's begin by looking at the safety zones around the aircraft. The safe zone is the area in front of the helicopter from the 9 o'clock position to the 3 o'clock position. This is the area in full vision of the pilot and medical crew. The caution zone is an area that extends from the back doors to the tail boom. The danger zone is the area extending outward from the tail boom to the tail rotor and is always avoided. This danger zone should always be clear of people, obstacles, and debris. Never approach the aircraft until the pilot or crew gives you an okay. This will be done by making eye contact with you, followed by thumbs up to signal your approach. Always approach from the front of the aircraft into the safe zone. This applies to every approach or departure. The safe zone is always used. To move from one side of the aircraft to the other, you must walk around the front of the helicopter. Never run in the landing zone. Again, never approach from the rear of the aircraft. Walk under the tail boom or around the tail rotor. The tail rotor is low and very hard to see. A mistake here could be fatal. On uneven terrain, remember to always approach from the downhill side. The main rotor blade will remain horizontal, and the uphill side ground clearance will be reduced. Approaching from the uphill side may cause your head to be struck by the main rotor, resulting in serious injury or death. Never approach as the helicopter is starting up or shutting down. During these times, the main rotor blade may dip, reducing ground clearance. The helicopter creates a strong wind and will blow dirt and debris and any loose items. Be sure that you have removed loose items, including items such as ball caps or other loose clothing. Use your protective clothing, helmet, and eye protection, and Turn your back to the rotor wash to help protect your eyes and face. You may want to keep the ambulance doors shut or otherwise protect the patient appropriately. Never chase after items that are blown off or away. The main rotor blade may dip as low as 8 to 9 feet, so never carry objects over your head. Keep everything at waist level and always be mindful of rotor clearance. Remember the danger near the tail of the aircraft. Contact with the tail rotor is fatal. Remain clear of the entire 100 by 100 foot landing zone when the helicopter approaches to land. Now that we have learned about basic aircraft safety, let's turn to the requirements of the landing zone. Setting up a safe landing zone will ensure the safety of the aircrew and those on the ground. Here are the basics. The landing zone should be at least 100 feet by 100 feet and free from obstacles. Select as large an area as possible for the landing zone. It should have a firm landing surface with a slope not greater than 6 degrees. When selecting the site, it is important to remember that the aircraft will always approach and depart into the wind. These paths should be clear of wires, trees, poles, or signs. As you stand in the center of the landing zone, outstretch your arm at a 15-degree angle and look for any potential obstacles above the level of your hand in the approach or departure path. Obstacles are often the greatest safety problem in the landing zone. Overhead wires are the biggest concern. Wires are very difficult to see from the air, and it is imperative that all wires and their location in relation to the landing zone be communicated to the pilot. Other obstacles, such as road signs, fences, or posts that are in the landing zone or around its perimeter, should be relayed to the pilot as well. These obstacles could cause damage to the tail rotor or the bottom of the aircraft. Debris is also a hazard, which could be blown into the rescuers or into the rotor of the aircraft. Loose debris must be removed prior to approach. Dust and powdered snow may create a visibility hazard as the pilot lands and takes off. This can be reduced by lightly watering down the landing zone area. Please do not limit your identification of obstacles just to the perimeter of the landing zone. Look at least 200 to 500 feet away and even further when identifying hazards to the safety of the landing zone. Anything you think might represent a potential obstacle should be considered as just that and should be communicated to the pilot. No vehicles may be in the landing zone or come within 50 feet of the helicopter at any time. If traffic is a potential obstacle, it should be stopped or slowed until a landing zone is clear for the aircraft. Again, let us re-emphasize the danger with overhead wires. A good way to help identify a wire obstacle is to put your squad car or engine under the wires with your overhead strobes on and communicate this to the pilot. The basic requirements for mountain landing zones don't change. However, wind, altitude, trees, and rock formations may require you to be more selective for your site. Be mindful in selecting a landing zone in a canyon because they can be strongly influenced by terrain and high winds. Use of designated landing zones is always helpful. Patient weights are important to convey to Medevac dispatch for summertime mountain operations. The landing zone can be marked using a variety of objects, including strobes, cones, paint, or marking tape. Be sure marking objects are secured and cannot blow into the aircraft rotor system. Use overhead red and blue lights to help locate the site. Clear lights, such as headlights, will affect the night vision goggle equipment being utilized by the crew. Extinguish all clear lights before the aircraft lands or takes off. Keep in mind, red and blue lights do not affect night vision goggles. Also, please remember to avoid shining any bright lights into the pilot's eyes. In addition to landing zone safety requirements, the landing zone commander is very instrumental in a successful landing zone. The landing zone commander is the person designated solely to prepare the landing zone and assist in the landing of the helicopter. The commander should be the person most experienced with landings and establishing a landing zone. The commander must also be able to clearly communicate over the radio.
Medevac 1, this is 3661 on stack D.
Copy you loud and clear. We're looking for ground information for our landing.
This contact with the pilot should always include the location of the landing zone in reference to geographical landmarks or coordinates.
We do have power lines to the east of your landing zone along Field Road.
It is important to communicate obstacle information, including their locations in reference to the landing zone, using the compass directions of north, south, east, or west.
The wind appears to be out of the south at approximately 3 to 5 miles an hour.
Communications must include wind speed and direction. The commander maintains communications with the pilot to advise any last-minute hazards or dangers that may arise, and to assure the pilot that the landing zone is clear of bystanders.
Okay, per the crew on ground, if you could hold your position for a couple minutes.
As the helicopter begins to approach, the commander should also clear out of the landing zone.
You are clear to land.
Copy, clear to land.
After landing, a flight crew member should be notified that the landing zone commander has designated a person to watch the tail rotor. The tail rotor guard is positioned outside the main rotor diameter, approximately to the side of the helicopter doors, and will guard against anyone approaching the tail rotor. Preparation of the patient should be consistent with other pre-hospital patient care. The patient should be kept at a safe distance outside of the helicopter landing zone and protected from flying objects and debris. When possible, the patient should be kept in the ambulance for protection. Take care to avoid loose clothing and blankets, which could be blown by the rotor wash. The flight team will provide any needed pre-flight education to the patient. The speedy, safe transport of critically ill or injured patients only occurs through a team effort of the ground crews and the crew of North Colorado Medevac. Designating and preparing a safe landing zone, effective communication by the landing zone commander, and proper patient preparation are key factors in a successful medevac situation. For more information on air transportation and safety training, please contact North Colorado Medevac, 1801 16th Street, Greeley, Colorado, 80631, or phone 1-800-247-5433. Let's all work together to save lives. At many hospitals, there is a designated helicopter landing zone on a rooftop or on the ground close by. Although in some cities, the local airport may be the closest safe landing zone. In either case, it is helpful for the crews on the ground to be observant of any debris, equipment, or loose items in the vicinity of the landing zone and remove them prior to the helicopter landing. Landing pads should be kept free of ice and snow in the winter, but ice melt is not recommended. Helicopters create strong downdrafts upon takeoff and landings, and even items as large as a pram may be displaced, so make sure that they are secured a safe distance away.
Hi, this is McKee.
If it is known that another helicopter is inbound or already on the hospital pad, please relay this information to the Medevac Communications Center or to the crew during their patient report call-in. When loading and unloading, it is helpful to understand the difference between a hot or cold procedure. The flight crew will advise and direct your activities around the aircraft in either case. A hot load or unload is done while the pilot keeps the aircraft running. The blades are kept at a high RPM and are tabled at approximately 11 feet. A hot load or unload might be utilized when a patient is in critical condition, requiring immediate intervention. A cold load or unload would be when the aircraft is shut down. If a facility requests our service, rapid transport is of the highest importance. The goal for our flight team is to have the patient ready to transport in under 30 minutes. Although this time may occasionally be briefly extended if procedures such as rapid sequence intubation or chest tube placement needs to be accomplished prior to transport. Specific time-dependent illnesses and injuries, such as code STEMI activations or epidural bleeds, may necessitate an even more rapid preparation. And in these cases, the flight team will make every effort to expedite the preparation time to 15 minutes. There are several ways in which the sending facility can assist the flight team in the facilitation of rapid transport times. Have all paperwork completed and copies available for the flight team prior to transport. This should include the transport authorization form, including name of the accepting facility and physician, consent form, laboratory tests, demographic sheets, nursing and physician notes, copies of radiological studies. The primary nurse or physician should be available to give a thorough report to the flight crew. Have procedures such as IVs, catheters, and NGs completed and secured prior to flight team arrival. It is often helpful to have a couple of staff members aid the flight crew in lifting and loading the patient onto the transport cot and into the helicopter. Make sure that your transport cot has an oxygen tank available. Call a report to the receiving facility. This can potentially be done after the flight crew has departed with the patient. If an ambulance transport will be needed for a remote landing zone, please have them dispatched with the flight team's estimated time of arrival. For more information on air transportation and safety training, please contact North Colorado Medevac, 1801 16th Street, Greeley, Colorado, 80631, or phone 1-800-247-5433. Let's all work together to save lives.